Another day, another story. In the 2019 to 2020 school year, 20.9% of New York City elementary and middle school students had obesity, and 6.4% had severe obesity, according to a study. Kira L. Argenio, mile per hour, from the New York City Department of Health and Mental Hygiene, and colleagues estimated the prevalence of obesity and severe obesity among youth in New York City before the COVID-19 pandemic, and examined time trends. The analysis included height and weight measurements of public school students, kindergarten through 8th grade, aged 5 to 15 years taken during school years 2011 to 2012 through 2019 to 2020, roughly 1.37 million unique students. Welcome to Tabo Eminent Channel. The researchers found that 20.9 and 6.4% had obesity and severe obesity, respectively, in 2019 to 2020. Overall, there were significant, consistent declines in prevalence from 2011 to 2012 to 2019 to 2020, 2.8% relative decrease in obesity and 0.2% in severe obesity. Increasing trends were seen among Black, Hispanic, and foreign-born students. Nearly all groups experienced significant increases in obesity and severe obesity from 2016 to 2017 to 2019 to 2020, relative change, 3.5 and 6.7%, respectively, overall, with some of the largest increases in obesity seen among those already bearing the greatest burden, such as Black and Hispanic students and youth living in poverty. Recent studies indicate that disparities in youth obesity are widening, particularly among socioeconomic and racial groups. Several factors contribute to these trends. Socioeconomic factors. Research shows that children from lower-income families and those with parents who have lower educational attainment are more likely to be obese. For instance, a study in Los Angeles County found that the odds of obesity among preschool-aged children from the poorest households increased significantly from 2003 to 2014. This indicates that socioeconomic disparities in obesity are intensifying over time, Cambridge University Press and Assessment. Racial and ethnic disparities. Obesity rates are rising more sharply among minority groups. For example, Black and Hispanic children have shown higher increases in obesity rates compared to their white peers. These groups also experience more significant declines in key health indicators, exacerbating racial health disparities, PRB. Geographical variations. Differences in obesity prevalence are also observed across various regions. Data from the Health Survey for England and the National Child Measurement Programme reveal that socioeconomic inequalities in obesity have become more pronounced over the years, with children in deprived areas showing higher obesity rates compared to those in more affluent regions. BMJ case reports. Impact of policies and economic conditions. The aftermath of economic downturns, such as the Great Recession, has exacerbated the disparities in childhood obesity. Economic hardships tend to impact low-income families more severely, limiting their access to healthy food and opportunities for physical activity. Cambridge University Press and Assessment. Socioeconomic disparities. Children from lower-income families are disproportionately affected by obesity. For example, in Los Angeles County, the obesity rate among preschool-aged children from the poorest households increased significantly between 2003 and 2014. This trend reflects broader national patterns where children in the lowest income brackets face higher obesity rates compared to their more affluent peers. State of childhood obesity. State of childhood obesity. Racial and ethnic disparities. Racial disparities in obesity rates are also widening. Hispanic and non-Hispanic Black children exhibit significantly higher obesity rates compared to non-Hispanic white and Asian children. In 2021 to 2022, about 22.7% of Hispanic and 22.0% of non-Hispanic Black children aged 10 to 17 were obese, compared to 13.1% of non-Hispanic white children. State of childhood obesity. Additionally, these disparities are exacerbated in rural areas, where access to healthcare and opportunities for physical activity are often limited. Rural Black communities, in particular, face higher obesity rates and related health issues compared to their urban counterparts, the University of Rhode Island. Geographical variations. Geographic location plays a crucial role in obesity disparities. Rural areas tend to have higher obesity rates due to factors like reduced access to healthcare services, fewer recreational facilities, and socioeconomic challenges. These regions often lack the infrastructure that supports healthy lifestyles, further widening the health gap between rural and urban populations, the University of Rhode Island. Impact of policies and economic conditions. Economic downturns, such as the Great Recession, have intensified these disparities by disproportionately affecting low-income families, limiting their ability to afford healthy food and engage in physical activities. Policy interventions are necessary to address these inequities by improving access to nutritious food and safe recreational spaces. State of childhood obesity. Socioeconomic factors. Children from lower-income families are more likely to experience higher rates of obesity. This is attributed to limited access to healthy foods and recreational facilities, higher exposure to marketing of unhealthy foods, and less time for parents to engage in active play with their children due to work constraints. BMJ case reports, MedExpress. Ethnic disparities. Ethnic minority groups often face additional challenges, such as cultural barriers and higher levels of socioeconomic disadvantage. For instance, data shows that Black, Asian, and minority ethnic children in the UK have higher obesity rates compared to their white peers, even after adjusting for socioeconomic factors. BMJ blogs. Impact of COVID-19. The pandemic has exacerbated these disparities. School closures and lockdowns have limited physical activity opportunities and increased reliance on cheaper, calorie-dense foods. This has particularly affected children from disadvantaged backgrounds, who may lack safe outdoor spaces and access to structured physical activities. BMJ blogs. Economic costs and health impact. Addressing these disparities is not only a moral imperative but also economically beneficial. Reducing socioeconomic disparities in youth physical activity could prevent numerous cases of obesity-related diseases and save billions in healthcare costs. For example, a recent study estimated that achieving more equity in physical activity among youth could save the US over $15 billion in societal costs, including medical expenses and productivity losses. MedExpress. Policy interventions. To tackle these disparities, experts advocate for comprehensive policy measures. These include improving access to healthy foods, enhancing physical activity opportunities in schools and communities, and targeted public health campaigns. Governments are urged to adopt a more interventionist approach to reduce inequalities and support healthier lifestyles for all children. BMJ blogs. Addressing these disparities requires multifaceted approaches, including improving access to healthy foods, enhancing physical activity opportunities, and implementing targeted interventions in schools and communities. These measures are crucial for mitigating the impact of socioeconomic and racial disparities on childhood obesity. PRB, BMJ case reports. By focusing on equity and targeted interventions, we can create environments that support healthy growth and development for all children. Thanks for watching. Request you to subscribe the channel.